Hello, my name is Diane Sullivan, and I am an AARP Nebraska volunteer with the West Omaha Community Action Team. Today we are here for a program called Be Red Cross Ready Coronavirus. I want to tell you a little bit about the program so that you'll know what's going on. And we are experiencing a pandemic of the coronavirus disease, COVID-19, respiratory illness. Older adults of any age who have serious underlying medical conditions such as heart or lung disease, diabetes, are at higher risk for severe illness. The American Red Cross will be providing education about the virus, as well as the best way to protect yourself and your loved ones during the Red Cross Ready presentation. I want to introduce Angela Hage. She has been with the Red Cross for about a year and a half. Before joining the Red Cross, she worked in emergency medicine for 2 years, as well as multiple stints doing humanitarian work internationally in the Caribbean and the South Pacific. She has spent most of her life dedicated to bringing communities to prepare for and respond to disasters of all sizes. And that is what she's most passionate about. In her spare time, she loves to read, paddleboard, and play volleyball. I would like to reintroduce Angela Hage, and please enjoy this presentation.
Thank you so much. I'm so excited to be here. As she said, my name is Angela. I've been with the Red Cross since about October 2019, so for the entire length of the pandemic. I have been with the Red Cross and I have seen kind of what has taken place before and during the COVID-19 pandemic. I want to thank AARP for allowing me this opportunity and allowing the Red Cross the opportunity to be here and present on coronavirus safety. I know we have been in this pandemic for over a year already, and a lot of this information may be repeat, but it is good information nonetheless, and it still holds true even today. Next slide, please. Oh. Not the one that says situation. It's okay, I can go ahead and talk while we are getting that PowerPoint up. So as you know, we are experiencing the COVID-19 pandemic, which is a respiratory illness caused by a new virus and is spreading quickly from person to person. Because COVID-19 is a new illness, much is still unknown about it, though we have made significant strides in the last year. However, we do know that the best way to prevent illness is to avoid being exposed to it at all in the first place. If you're unfamiliar with what a pandemic is, it's a worldwide spread of a disease, and it poses a serious public health risk. So COVID-19 is caused by a recently discovered coronavirus. Coronaviruses are a large family of viruses which may cause illness in animals or humans. Viruses and the diseases they cause often have different names. For example, people often know the name of the disease, such as measles, but may not know the name of the virus that causes it, which is rubeola. Based on current information, older adults and people of any age who have serious underlying medical conditions like heart or lung disease or diabetes may be at higher risk for severe illness because of coronavirus. People with other high-risk conditions could include those with moderate to severe asthma, renal failure, liver disease, or severe obesity, or those who are otherwise immunocompromised. Call your healthcare provider for additional steps you may need to take to protect yourself. They will know best. Because the virus is new, people have no immunity against it so far. That's why public health officials are recommending community-wide mitigation strategies such as staying home, social distancing, wearing cloth face coverings while in public, and good hygiene practices to slow the spread of 19 and help keep everybody safe. Experts stress that slowing the spread of COVID-19 is critical to minimizing the number of people who get sick at the same time and protecting those at higher risk. This is why we must work together as a community to reduce the spread of the disease. Next slide, please. COVID-19 is a new disease, and like I said, we're still learning a lot about it. It is spread mainly through person-to-person contact. That's what we believe so far. Between people who are in close contact with one another, about 6 feet. It's also spread through respiratory droplets produced when an infected person coughs, sneezes, or speaks. These droplets can land in the mouth or nose of people who are nearby or possibly be inhaled even into the lungs. We know now from recent studies that a significant portion of individuals with COVID lack symptoms, and that even those who eventually develop symptoms can transmit the virus to others before showing symptoms. This means that the virus can spread between people interacting in close proximity, even if those people are not exhibiting symptoms. The virus may also be transmitted by touching a surface that has the virus on it, and then touching your mouth, nose, or possibly even your eyes. This is not thought to be the main way the virus spreads, but we're still learning more, like I said. Next slide, please. As you probably know, symptoms range from very mild or even asymptomatic to severe illness or even death. These symptoms may appear anywhere from 2 to 14 days after exposure. And these symptoms include fever, cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, or new loss of taste or smell. Next slide, please. Because there are so many different ways, because the virus spreads so easily, we all have a role to play in order to slow the spread. Even if you're young or otherwise healthy, you are at risk and your activities can spread the virus to others. Together, we can slow the spread of the virus and protect individuals who are at higher risk of severe illness, such as older adults over the age of 65, people who live in a nursing home or long-term care facility, other people who live in congregate shelter or congregate housing settings, and people with serious underlying medical conditions. Next slide, please. There are 5 actions that you can take to protect yourself and others. And while there is now a vaccine available, we still have to take precautions against the virus. The best way to prevent illness is to avoid being exposed to it at all. So first and foremost, clean your hands often and clean them well. Wash your hands with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose, coughing, or sneezing. Soap and water are preferable, but if soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. And avoid touching your eyes, nose, and mouth with unwashed hands, or even with washed hands. Just try to avoid your face in general. Number 2 is avoid close contact, especially with those who are sick. Stay home as much as possible. Avoid non-essential outings whenever possible and large gatherings of people, both in public and in private. If you do have to go out, practice social distancing by ensuring that you keep 6 feet between you and others while in public. Remember that some people without symptoms may be able to spread the virus, so just because they're not sick doesn't mean that they won't get you sick. Keeping physical distance, make sure to keep physical distance from others. It's especially important if you're at a higher risk of getting sick. Cover your mouth and nose with a cloth face covering when around others. You could spread COVID-19 to others even if you don't feel sick, just like they can spread it to you if they don't feel sick. Everyone should wear a cloth face covering whenever they're in public. As a reminder, face coverings should not be placed on young children under the age of 2, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. The cloth face covering is meant to protect others in case you're infected. And continue to keep about 6 feet distance from you whenever possible. The cloth face covering is not a substitute for social distancing. Number 4, cover your cough and sneezes. If you're in a private setting and don't have your mask on, remember to always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Throw away any used tissues that you use and immediately wash your hands with soap and water for at least 20 seconds. And number 5, clean and disinfect. Clean and disinfect frequently touch surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks, or any other thing that you may touch on a regular basis. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. Okay, next slide, please. Thank you. Stay connected, but practice social distancing. Strengthen social ties while maintaining social distancing. As you know, we need each other now more than ever. We've been in this pandemic over a year, and it's hard. It's hard to be here. It's hard to stay away from people, and it gets very lonely. So we really do need people more than ever. So stay connected with your loved ones through video calls, phone calls, texts, or social media. Check in with them. If you can do social distance gatherings in your car or in a big park, that's a great way to stay connected while also staying safe. If you do meet in person, remember social distancing. Avoid large gatherings in private or in public. Maintain a physical distance of at least 6 feet and avoid close contact with those who do not share your home. Limit visits with family members and friends who don't share your household, and be sure to take all precautions when you do. When allowed by public health authorities, it is still best to avoid group settings and mass gatherings unless essential whenever possible. Next slide, please. Listen and follow the directions of your state and local authorities. Please follow stay-at-home recommendations. Staying at home means that you remain at home as much as possible and only go out to purchase essential supplies, visit medical professionals, or leave during an emergency. Use telemedicine services if you can, which enables you to communicate with your doctor over video, phone, or email rather than face-to-face. Unless you're showing signs of illness or have tested positive for COVID-19, going outside to exercise and walk pets is okay. Remember to practice social distancing and keep at least 6 feet. Avoid close contact with those who do not share a home with you. Next page, please. Or next slide, I apologize. Listen and follow the directions of your state and local authorities for isolation and quarantine instructions as well. Isolation and quarantine measures may sound scary, but they are designed to help prevent the spread of the disease. Isolation separates sick people from people who are not sick to help prevent the illness from spreading. And quarantine separates and restricts the movement of people who were exposed to COVID-19 to see if they become sick. A quarantine helps to prevent people from unknowingly infecting anyone else. Next slide, please. So what do you do if you get sick? If you are sick or you're not feeling well, follow the tips from the CDC to help protect other people in your home and your community. Keep in mind that people who are mildly ill with the coronavirus may be able to recover at home and may not need to go to a hospital. Please stay home, self-isolate, and contact your healthcare provider if you are sick. Stay home to avoid getting others sick. Don't go to work, school, or public places, and avoid public transportation, ride sharing, or taxis. Separate yourself from others and pets in your home if you're sick. As much as possible, you should stay in a specific sick room and away from other people in your home. Use a separate bathroom if you can. And then, of course, call a healthcare provider for medical advice. Then make sure that you follow their advice. As you self-isolate at home, if you're sick or something, don't have any visitors other than caregivers. Monitor yourself per your healthcare provider's instructions. Take care of yourself, including rest and hydration. This is very important and will help you recover faster. Avoid sharing personal household items if at all possible. Don't share dishes, drinking glasses, cups, eating utensils, towels, or beddings with other people in your home if you're sick. Wash these items thoroughly after using them with soap and water or put in the dishwasher or washing machine. If you can, wear a mask over your nose and mouth if you must be around other people or animals, including pets, even at your house. You don't need to wear the face covering if you're alone, but if you can't put a cloth face covering, make sure that you cover your coughs and sneezes in some other way. And again, try to maintain at least 6 feet distance, especially if you're sick. This will help protect the people around you. Remember that masks should not be worn by children under the age of 2. That's very important. Or any individual who would not be able to remove the mask without assistance. Cover your coughs and sneezes. Make sure that you cover your mouth and nose with a tissue and throw any of it away in a lined trash can. Immediately wash your hands after. On your own, clean and disinfect frequently touched surfaces in your sick room and bathroom every day. Let someone else clean and disinfect surfaces in common areas, but not your sick room or bathroom. If a caregiver or other person needs to clean and disinfect a sick person's bedroom or bathroom, they should do so on an as-needed basis. The other person should wear a mask and disposable gloves and wait as long as possible after that sick person has used the bathroom or other area. Next slide, please. Seek medical attention immediately if you have a life-threatening medical emergency. If you do have COVID or you do have symptoms and you have an otherwise medical emergency, notify the operator that you have or think you might have COVID-19. If possible, put on a mask before medical help arrives. If you develop any of the emergency warning signs for COVID-19, get medical attention immediately. These warning signs include trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, or bluish lips or face. This list is not all-inclusive, so please consult your medical provider for any other symptoms that are severe or any other symptoms that may concern you. That's your best place to go for advice. If you develop signs of your illness worsening or of life-threatening, if they become life-threatening, get medical attention immediately. Before going to a doctor or emergency room, call ahead and tell them your symptoms if you're able. They'll tell you what to do from there. If possible, put on a mask before you leave your room and keep a safe distance from other people. Follow care instructors from your healthcare provider and local health department. That's the best thing you can do. Next slide, please. So, how do you prepare? We know that COVID is a possibility, and we now know even with the vaccine, it is possible to still get sick. So how do we prepare and be ready in case we do get sick? So first and foremost, check your county or state website for timelines, closures, and local information on COVID-19 and how it affects your community. For official, credible sources and accurate information on COVID-19, you can go to the CDC website. You can go to American Red Cross, which would just be redcross.org/coronavirus, or your local Department of Public Health. Make sure that you know the signs and symptoms of coronavirus and monitor yourself regularly for it, as well as monitor your loved ones. Know how to slow the spread and protect yourself and family. Help individuals at higher risk of severe illness and support older individuals who may need help. And take steps to protect others. And unfortunately, we do have to mention that there are scams out there. So scammers are taking advantage of people's fears, and the Federal Trade Commission has tips to help protect you and others. Beware of viral videos suggesting potentially dangerous or toxic home preventatives, such as drinking excessive amounts of water or mouthwash. Please be aware of scams. We don't want you to fall victim to any of those, so make sure that your sources are reliable. Next slide, please. Another way to prepare is to create a household plan. COVID-19 could last for a long time. We've already seen it for over a year, and I don't believe it's going to go away anytime soon. So while things are starting to look up, we still want to be prepared. So you want to create a household plan that can help you and your household prepare. You can find resources for this at redcross.org/coronavirus. Some things to include. Well, first, you want to make sure that you talk with people about your plan. Meet with household members, phone relatives, and friends to discuss what to do and what the needs of each person will be. Establish ways to communicate with one another. Create an emergency contact list. Ensure that your household has a current list of emergency contacts for families, friends, neighbors, healthcare providers, teachers, employers, the local health department, and any other community resources you think you may need. Make sure that everyone knows how to use text, video, or email features. Plan what you will do if you or someone in your house gets sick. Sign up for telemedicine if you can. Design a room in your home that can be used as a sick room if needed. Have a care plan in place for yourself and help loved ones develop a care plan as well. A care plan summarizes your health conditions, medications, healthcare providers, emergency contacts, and end-of-life care options. Determine who will care for you or your loved one should someone become ill, and make sure that they understand your medical needs and that they have a copy of your care plan. Plan ways to care for loved ones who might be at greater risk for serious complications. Based on current available information, older adults and people with underlying medical conditions like heart or lung disease may be at higher risk for severe illness. People with other high-risk conditions could include those with asthma, renal failure, liver disease, or obesity, like we talked about earlier, or those who are otherwise immunocompromised. Have a 1-month supply of medication and a 2-week supply of food to avoid frequent shopping trips and limit your potential exposure to the virus if at all possible. A 1-month supply of prescription medication does include over-the-counter medications such as cough suppressants and fever-reducing drugs that you might need to take. Ask your physician or local pharmacy if prescriptions can be delivered to your home or if you can pick them up at a drive-thru. Order medication refills from them as you normally would. A 2-week supply of food includes water, household cleaning and disinfectant supplies, bar or liquid soap, paper products, personal hygiene items, and medical supplies, including a thermometer. Next slide, please. We do know that COVID has caused a lot of stress on communities, on individuals, on families, on schools, on everyone. It has impacted everybody differently, but it has impacted everybody. For many of us, COVID-19 has disrupted our routines and made everyday activities such as work and caring for loved ones challenging. These changes, on top of the general uncertainty around the pandemic, can create feelings of stress, fear, and nervousness. These feelings are normal, and people typically bounce back after difficult times. Children and teens may respond more strongly to the stress and anxiety caused by COVID-19 and might become frightened that they or their loved one may get sick. Take time to talk calmly and reassure children about what is happening in a way that they can understand. The following information can help you cope with stress and support others during this emergency. It's normal for people to have these types of feelings right now: anxiety, uncertainty, fear of getting sick or a loved one getting sick, guilt about not being able to fulfill responsibilities, thoughts of anger, blame, worry, or fear, worry about loss of income, and even boredom and isolation. Next slide, please. People's reactions appear in different ways, not only in the way someone feels, but in the way they think and what they think about, their sleeping habits, how they go about daily living, and the way they interact and get along with others. Here are a few steps to help you cope with stress. First and foremost, take care of yourself. Stay physically healthy. Eat healthy, drink plenty of water, and get enough rest. I know it's very easy to munch on snacks because of boredom or isolation, but try your hardest to eat healthy, full meals. Unless you're showing signs of illness or have tested positive, going outside to exercise is a great way to maintain health and get some energy out. Don't forget to practice social distancing and keep at least 6 feet away. Make sure to continue connecting with loved ones through video calls, phone calls, texts, or social media, or if your public health guidelines allow it, social distance gatherings. Stay informed with accurate, reliable information from credible sources. Avoid social media accounts and news outlets that promote fear or rumors, of which there are many these days. Be patient with yourself and others. It's common to have a number of temporary stress reactions, such as fear, anger, frustration, and anxiety. Hold an image in your mind of the best possible outcome. Make a list of your personal strengths and use these to help both yourself and others stay emotionally strong. Relax your body often by doing things that work for you. Take deep breaths, stretch or meditate, or engage in activities that you enjoy. If you are religious or spiritual, follow practices that provide you with comfort and emotional strength. You can also sign up for free Red Cross classes online that cover mental health first aid for COVID-19. Make sure that you're also helping others. Reach out to older adults or individuals with chronic health conditions and offer to help. Check in with them regularly over the phone and see if they need any supplies delivered. Talk to your children. Explain why this is happening and how long it might last. Use language that is normal and consistent with how you usually communicate. Be creative and think of fun activities that will occupy their time. And keep a schedule, set appropriate limits, and maintain usual rules whenever possible. Don't forget to take care of your pets as well, which can be an essential part of your support system. If you have a pet, you know that they're a part of your family and they They belong in your family, and you need to make sure that you take care of them as well as yourself. Like people, pets react to changes in their environment and routine, so their behaviors may change as well. Keep track of their well-being and take care of their needs as best as you can. And last but not least, make sure that you show kindness to people who may not have a support system who are isolated. There may be limits to what you can do in reaching out, but a little kindness may be just what someone needs. Next slide, please. We all have a role to play. Working together, we can slow the spread of this virus and protect everyone in our community, including those most at risk. For more information on staying safe and helping others, please see redcross.org/coronavirus. That's all I have. Thank you so much for joining me. I really appreciate AARP. Thank you for giving me the opportunity to teach on this and to share some information, and I'll pass it over to you for questions.
Thank you so much, Angela. That was really informative. But I do have a couple questions. How has COVID impacted your disaster efforts that Red Cross is so well known for?
Sure, yeah. So if anyone is unaware, Red Cross does do disaster relief across the country. We even do some things internationally, though that is not quite happening right now. But we have taken significant steps since the pandemic started to ensure that we continue to provide disaster relief operations and support around the country, while also acting in the best interest of our safety and the safety of those that we serve. So one big change that we've made is doing non-congregate sheltering whenever possible. So during hurricanes or flooding, we often would open a shelter in a big gymnasium or something like that and have cots set up. But because of COVID, does pose a serious health risk. And so instead, we have tried to do non-congregate sheltering, whether that be through dormitories or hotel rooms, and we can just keep families together. So that way they are not exposed to people who would not otherwise be in their household. Of course, this is not always possible because we know that some disasters are just too massive, but whenever possible, that's what we do. We also have majorly amped up our PPE and temperature checks. So every volunteer that deploys to a disaster and every client in a shelter is provided with PPE if they need it, and they are asked to wear their masks. All Red Crossers are required to wear masks whenever on an operation, and we do temperature checks on a daily basis coming in and out of shelters and for every volunteer who is on the operation. We also have adjusted a lot of our response to be done virtually. So one major thing that we do on a regular basis is responding to house fires and providing financial and emotional support to those impacted. This is something we were a little bit concerned about. We didn't know how we were going to adjust to that during COVID, but our organization has been able to kind of change our protocols and create a way for us to provide these services virtually while also still providing the same support emotionally that we were before. So through social distancing and through completely virtual responses now, we have new systems we can use to provide people with financial support without ever actually having to hand something to them directly. And that's been a great way for us to continue to provide the services that we always have while also staying safe. And then just simple things such as when we provide food on an operation, instead of doing an assembly line where we put it in their box, we just do prepackaged meals now. And we make sure that we do a set down and step back method so that we're never within 6 feet. So we'll put a box of food on the table and step back 6 feet and allow the client to receive it from there. So mostly simple measures, but they've been really great to help us continue to provide the disaster relief that we always have, while also ensuring the safety of ourselves and those that we serve.
Wow. You've done everything possible, it sounds to me like. I forgot to introduce myself. I'm Janet Davis, and I'm a member of AARP, a volunteer for them. One of the major things that has helped me cope with stress during that time is taking advantage of all of the AARP videos and movies for grown-ups, and zooming in on different things. It's been a big help for me to keep contact with outside my household. What have you done to cope with stress during
Yeah,
this time, Angela?
that's a great question. So I don't live anywhere near my family. My closest family lives about 1,200 miles from me. So that has been very hard, but we have continued to stay in contact through video calls and through safe traveling whenever the CDC had been able to recommend that. But things that I do on a more regular basis would be paddleboarding. I really like to be on the water. So during the summer month, I really like to paddleboard. It's a great way for me to get exercise, for me to kind of clear my mind, and also you're nowhere near other people when you're in the middle of a lake. So that's been really good. I also really love to read. I've read about 30 books in 2021 so far, and I'm hoping to read 100 this year. I haven't done that any year yet, so that's my goal. So I sometimes just hang up my hammock outside and sit in my hammock and read after work. Thankfully, the weather's finally starting to warm up, so hopefully I'll be able to do that a little bit more. And then I have tried to get some travel in while also staying safe. So I've done some road trips and that sort of thing, explored a few new places around. I live in Omaha, so I've explored a few new places around Omaha and Nebraska, and took a little road trip by myself up to Minnesota and South Dakota. Very easy to maintain social distancing in those states,
Sure.
while also experiencing some new things. So just try to keep my brain active while also keeping those around me safe.
Sounds good. Sounds good. We each have to find our own way, but sounds like you've done some great things and some fun things that you might not have done otherwise. The paddle boating, probably. Another thing I was wondering about, we hear all kinds of recommendations for how things are changing. Once we are fully vaccinated and we've done that 14 days to make sure our immune system has built up, does the Red Cross have any recommendations or changes that you foresee coming about?
So we would always defer back to CDC, because that's ultimately where we're getting our information from as well. But as far as we know, it does it helps slow the spread for sure. But you could still get the virus, and you can still spread it to others. So we would recommend that you still maintain that 6-foot distancing whenever possible and wear masks when in public. But we would always just defer back to CDC and what they're saying and what recommendations they change as we learn more about the vaccine and how it can help us and keep us safe.
In other words, we're all in this together. We needed help and advice from everything available.
Absolutely.
I don't have any more questions right now, Angela, and I don't see any in the chat. But thank you so very much for taking a time out of your day to help us to understand the situation, to reinforce what the CDC has been telling us. And it's a great reminder that we're all in this together. And as time goes on, it's apparently that the pandemic isn't over, but we're working on doing the best we can, and we thank the Red Cross for your help in doing that.
Thank you so much. It's really great to be able to partner with you in this way. We love building our community partnerships and helping each other learn more about disaster relief. That's obviously what we're very passionate about, and we're really grateful for this opportunity to share that with you.
I'm so glad that your disaster relief efforts have not had to be curtailed. They've just been altered a little.
Yeah, absolutely. Same mission, different strategy.
Okay. Thank you so much.
Thank you.
Thank you.